Hello, my name is Connor Hargis. I'm doing a video for week 5 about dreams and the grieving process. The purpose is to discuss how dreams that clients have who are going through a grief or mourning can help them discuss things with the counselor about their grief, and also to kind of integrate their own experiences uh, adjusting to the death of their loved one by understanding their own dreams. Dreams can, according to our text by Warden, can sometimes reflect the tasks of mourning. Uh, uh, Tasks, aka proactive stages, which are accepting the reality of the loss, processing the pain of grief, adjusting to life without the deceased, and finding a way to maintain a connection with the deceased while moving on with life. So different types of dreams can correspond to each one of those tasks or quote-unquote stages. For the first one, acceptance or accepting the reality of the loss, an example of a dream that a client might have after a death of a loved one, let's say, like in our case study, similar to that, someone lost their father. They might have dreams immediately after of their father still being alive, and that is their brain potentially coming to terms with the loss of their father and learning to slowly accept that reality, because it might be so jarring to suddenly just totally accept that in every part of their conscious and subconscious. The next stage, an example of a dream for the processing stage, processing the pain of grief, might be some dreams of possible conflicts or painful memories with the loved one. This might include arguments or fights, things like that. For the next stage, which is adjusting to life without the deceased, an example of a dream might be the lost loved one offering guidance or offering some type of comfort or being encouraging in some way. And then for the final stage, which is kind of maintaining a connection with the memories of that loved one while moving on in life. An example of a dream for that stage could be maybe some unresolved conflicts that the client needs to work through to find peace and move on. So some of the insights that I gained from this chapter, I didn't actually know how important dreams could possibly be in grief therapy. We learned about in our counseling theories class about Freudian psychoanalysis and some other theories that deal with dreams, but I did not know that grief therapy can draw on dreams to help guide both the counselor and the client through grief. And there are certain things that dreams can symbolize that relate to the process of mourning and of grief, especially in the case of the death of a loved one, which is basically what our text covers, that type of grief. In addition, I've known this personally about how sometimes dreams can reveal conflicts that I haven't subconsciously or totally moved past. But this is true for, this is just as applicable for dead loved ones as it is for living ones. So that was interesting to learn and something to think about in my own future practice. Additionally, dreams can help bring our subconscious into our conscious awareness. Sometimes trauma work or grief work, if what is beneath the conscious level is brought too quickly to the surface, it can almost re-traumatize the client. But in dreams, this is your body's way, your mind's way of naturally bringing this back up into the conscious mind. And so that can be a very helpful tool. Next, we move on to the case study. This is in chapter 10. It's called Grief Sketch 3. Essentially, there is a woman who is middle-aged and not married, not presumably having a boyfriend. She's single, and recently, within 3 months, her alcoholic stepfather died very suddenly from a heart attack. He had basically been, from what I understand, her father figure who came into her life when she was 3 years old and had physically and sexually abused her until she left the house at age 17. Because this is my assumption, because of these painful memories and the fear associated with them and other negative emotions, she was happy to hear of his death. I assume that's why she was happy to hear of his death, and is glad that he is finally out of her life. She can also only really remember negative things about him. She doesn't really have fond memories. Whether or not, happy memories occurred or happy moments occurred, she does not really think of those. She thinks only of the negatives. And then since his death, she's had some recent dreams about him having his arms stretched out towards her, which I can imagine would be very upsetting in the context of his abuse towards her when she was younger. And so this is actually disturbing her so much that she can't focus on work, and decided to come seek counseling. So some of the symptoms, the thing that stuck out to me about this is that because he was her primary father figure, which is such an important role in a child's life, even though he was clearly a poor example of that, he still fit that role and still fit some kind of important need in her life. And so to lose that person from the face of the earth, despite all the horrible things he did, it still can be a very upsetting. If someone has, and this is not just for step parents, this is for parents or even for siblings or spouses, that it could be a very tumultuous relationship. But if the person fit a need, it's still going to be upsetting. And I can imagine that she is upset, or she is frustrated that she is upset because of the things that he did to her. She doesn't want to miss him, or doesn't want to feel like she should be sad about this because of the things he did. But nevertheless, he did fit that role. I would classify this case less as normal grief and more as complex grief because of the relationship that she had with her deceased stepfather. This is not going to be a normal, quote-unquote, normal case of that she might have had if it was a healthy relationship with her stepfather, if her stepfather was a kind and loving man who did not sexually and physically abuse her. This is going to be very complex because all of these conflicting emotions, loss, grief, also anger, resentment, disgust, maybe shame, guilt, all these things are kind of swirling around, and they're causing her so much disturbance that she can't even focus on work. So I think this is a case that might take a while with therapy, and it might even take a while to broach the subject with the client that her stepfather did fill an important and necessary role. I would imagine that the first few sessions would be reassuring and affirming her that she did not deserve what he did to her, and that what he did was wrong, and that it was in no way her fault, etc. before moving on to the possible good things that he did or things that she might miss. Because if I did that as a counselor too early, it could just cause maybe some internal cognitive dissonance that is not helpful and just complicates the grieving process. The fact that his arms are outstretched towards her, I think is a sign that her subconscious is slowly being brought up to her conscious that he did in some way provide a helpful and necessary role to her. It's just a very slow process, clearly, and complicated by the other factors. As far as if she is having sleep difficulties or difficulties going to sleep, I would likely help her to understand that these dreams are not evidence of her accepting his wrongdoing or forgiving it in any way. It's just it's something that she can't control, and she should not feel guilty about what she's dreaming or not dreaming. And that the dreams, I would reassure her that these dreams will not last forever. They are part of the grieving process. Hopefully that can provide a modicum of comfort and peace so that she is able to fall asleep and get through this period of these difficult dreams. Just in summary, we discussed how dreams can help in grief counseling and in the grieving process of the client who has lost a loved one. And I encourage the rest of our class to think about how they might integrate dream work into their own therapy, especially in grief and grief work. And that is my video. Thank you.